Virtual reality exposure therapy, or VRET for short, is a promising approach in treating phobias in an effective, cost-efficient, scalable, and individually adaptable way. Although 7 to 9% of the population suffer from simple phobias, such as fear of heights, only few people seek therapy, due to, among other reasons, a lack of motivation. To tackle this problem, a novel concept called Playful User-generated Treatment, or PUT, was derived from expert interviews and literature review. PUT was specifically designed for the treatment of acrophobia and divides therapy into 2 steps. First, users enter a design phase in which they can shape and design a terrain in tabletop mode with a top-down view. Afterwards, users enter an exposure phase in which they experience the very same terrain from a first-person perspective with a realistic scaling of the environment. Following a user study, in which PUT showed positive effects on player experience, an online survey with 13 practicing psychotherapists was conducted. The focus of this evaluation was to work out specific opportunities and challenges of the PUT concept. For this purpose, the survey contained qualitative items that were analyzed by inductive category formation. Ultimately, 5 opportunities and 3 challenges were identified. PUT allows for a graduated habituation to anxiety-inducing situations. It is capable to increase perceived control and self-efficacy. It improves the interaction between therapists and patients, but should not be seen as a replacement for actual communication. PUT enables an economic usage of VR while providing a realistic environment mimicking real anxiety triggers. However, depending on the application PUT is incorporated in, a lack of realism could be problematic. Finally, VR exposure alone may lead to pseudo-habituation to the virtual scene, whereas anxiety towards real exposure persists. For further details, please refer to our paper. Thank you for your attention.